All right, get this. Did you know that by the year 2026, over 60% of US physicians are expected to be using AI tools in some part of their daily workflow? Just take a second to process that. What really surprised me diving into this is that we aren't talking about some distant futuristic possibility anymore. We are talking about a very real operational reality happening right now in the exact hospitals and clinics that you and I visit. So, welcome to this explainer. I am so thrilled you're here because today we are completely cutting through all that sci-fi hype. We're going to look at the pragmatic, on-the-ground reality of healthcare AI. Drawing directly from the comprehensive 2026 Guide for Health IT Leaders, we'll uncover what this technology is actually doing, how it's transforming patient care, and what it really takes for health systems to implement it safely. Here is our roadmap for today. We'll start with Section 1. The healthcare AI reality. Then Section 2, breaking down the tech. Section 3 covers real-world use cases, followed by Section 4, navigating risks and rules. And finally, Section 5, the roadmap to success. Okay, let's dive right into Section 1, the healthcare AI reality. Let's go ahead and pull back the curtain on what's actually happening on the ground. We all tend to picture the myth on the left, right? These autonomous robot doctors that are somehow going to diagnose and treat you without any human intervention. But the reality is far more practical. The heavy lifting of AI right now is happening in administrative automation, triage, and what we call ambient clinical scribes. It's really not about replacing clinical judgment at all. It's about reducing the friction between the clinician and the patient. And this rapid adoption, it isn't just because the tech is cool. It's happening because three massive forces are colliding right now. On one hand, we have an absolute explosion in data volume. Things like electronic health records and medical imaging data have grown way faster than our human capacity to review them. And on the other hand, we have severe clinical staffing shortages and rampant burnout. In fact, the documentation burden has literally become a staff retention issue, not just an efficiency one. I found it absolutely fascinating how AI is stepping in as a desperately needed solution to this specific systemic crisis. And because it solves such a massive problem, the financial scale here is just staggering. In 2026, the global AI healthcare market is estimated to sit at about $56 billion. But if you forecast out into the early to mid-2030s, we are looking at an explosive average projection of $750 billion. That's a 35 to 40% annual growth rate. To put that into perspective, this massive investment means the way your personal health data is handled, and ultimately the way your care is delivered, is going to fundamentally transform over the next decade. Which brings us to Section 2, breaking down the tech. Now, to truly understand the impact of all that investment, we need to stop using AI as a catch-all buzzword. In healthcare, it isn't just one magic algorithm. It's actually a collection of distinct technologies, and they each have entirely different risk profiles. You have machine learning, natural language processing, computer vision, and generative AI. Each of these is a totally unique tool tailored for very specific clinical and operational tasks. So let's walk through this taxonomy together. Take natural language processing, or NLP. Have you ever been to the doctor and felt like they were just staring at their computer screen typing the whole time instead of, actually looking at you? Well, NLP powers AI scribes that literally listen to the conversation and draft the clinical notes automatically. It is kind of like a technological Trojan horse that actually brings the human connection back to medicine. Meanwhile, deep learning is the powerhouse analyzing incredibly complex medical images, like X-rays and MRIs, to spot tiny anomalies. And machine learning, that's working behind the scenes to predict things like hospital bed demand or patient risk, way before a massive rush even happens. And this brings us to a highly critical warning from our source material. It states, treating AI as one procurement category is one of the most common strategic mistakes health systems make. Because think about it, lumping an AI scribe that drafts a note into the exact same bucket as a deep learning algorithm that detects tumors completely ignores the fact that they carry vastly different regulatory requirements and liability weight. You simply cannot buy AI the way you buy standard software. Let's move on and look at how this plays out in Section 3, real-world use cases. When we look at the real-world applications running in hospitals today, it's really interesting to see exactly who feels the impact first. For physicians and nurses, the absolute biggest win is less documentation burden through those AI scribes we just talked about. For the hospital's operations team, it's administrative efficiency, like automating those deeply frustrating prior authorizations for insurance. And over in radiology and pathology, AI is flagging imaging abnormalities to give doctors incredible diagnostic speed. just to ground this in hard data, there are currently over 340 FDA-cleared AI-enabled medical devices on the market right now, highly concentrated in radiology, cardiology, and stroke detection. But here is the really reassuring takeaway. In practice, these tools function as a second reader. They triage work lists rather than issuing final autonomous diagnoses. The human is strictly kept in the loop, which is exactly what regulators and malpractice insurers require to keep patients safe. When you add all these inefficiencies together, industry estimates suggest AI could generate roughly $360 billion in potential annual U.S. healthcare savings. So, what does that actually mean for you? Well, it points toward a future of drastically more efficient care delivery, shorter wait times, and potentially a much-needed lowering of the massive systemic costs that burden patients today. And within all of this, we absolutely have to talk about generative AI specifically. Its footprint in healthcare is projected to explode from about $4.7 billion in 2026 to nearly $40 billion by 2035. Right now, sure, it's mostly doing administrative drafting, but it is expanding cautiously and rapidly into actual clinical decision support. So we know the tools work, but what happens when things go wrong? Let's get into Section 4, Navigating Risks and Rules. The savings are massive, for sure, but the hurdles are also incredibly significant. Algorithmic bias from non-representative training data can create real clinical exposure. Broad data access increases HIPAA and privacy risks. There's also massive regulatory uncertainty and liability ambiguity, meaning it's just really unclear who is accountable when an AI-assisted decision causes harm. Plus, if clinicians don't trust the tool, it just gets abandoned anyway. But what I found fascinating in the guide is that these are reasons to build strict governance from day one, not reasons to avoid AI entirely. And here is a surprising operational fact. When hospital IT projects fail or run out of money, it's rarely because the AI model wasn't accurate. Actually, EHR integration and workflow redesign usually blow the budget, not the software licensing. Getting a shiny new AI tool to successfully talk to a clunky, legacy electronic health record system is much harder in reality than it looks in a polished sales demo. So how do they pull this off? Let's check out Section 5, the roadmap to success. How do successful health systems navigate this total minefield? Well, they aren't guessing. They're following a highly disciplined 5-step blueprint. Step 1 is assessment, auditing data quality and interoperability. Step 2 is the pilot, tightly scooped to just one single use case. Step 3 is validation against real clinical outcomes, not just lab accuracy. Step 4 is implementing strict governance and audit trails. And only then, at Step 5, do they scale. The core takeaway here is that fixing those foundational data problems absolutely must come long before anyone launches a flashy pilot. In fact, the guide really hammers home this rhythmic mantra for successful AI adoption. It's basically this: establish governance before scale. Prioritize interoperability over model quality. You can have the absolute smartest AI model in the entire world, but if it doesn't seamlessly integrate into the doctor's existing workflow and data systems, it is practically useless. Which brings us to our final quote from the guide. The organizations getting real value are the ones with the most disciplined implementation process. Because integration and governance gaps are what cause projects to fail, the guide stresses that choosing the right technology partner is completely critical. Partners like 200OK Solutions, for example, work with healthcare organizations to ensure AI strategy is deeply grounded in operational priorities, executing secure, HIPAA-aligned integration, and pacing the digital transformation around what a health system can actually absorb safely. So, AI in healthcare is no longer just a speculative bet. It's an operational reality that will directly impact the care you receive. So, I'll leave you with this provocative question to think about the next time you step into a clinic. Is your healthcare provider just chasing the AI hype, or are they following a disciplined roadmap to build a true operational advantage? Thanks so much for joining me on